All right, hi, Dr. Nikita Vizniak, and today I'm going to walk you through the Orthopedic Assessment textbook that's used by thousands of students around the world, and we are now into our 7th edition, believe it or not. So first thing to get, it's written by myself, and I'm transitioning over to Dr. Buse, who has also been a fantastic help for the writing of this book. And of course, we can never forget all of our other contributors who have helped make this possible as well, and all of you who are fantastic readers and really enjoy our content. So a couple of key things to get for this text is, of course, the table of contents. So a couple of key things here just to start off with is we begin with just history and records. We go through physical exam processes, neurologic exams, head and neck exams, and then, of course, spinal effectively exams, then upper extremity, then lower extremity, followed up by the appendix. But the key thing to get here is we follow a pretty simple process, and the process is show you anatomy first, then we progress into the assessment options, and we realize that the assessment is therapeutic. If you're not assessing, you're just guessing. More accurate assessment equals better person-centered outcomes and ultimately results for people that you're trying to help. So each chapter starts with objectives at the start and ends with a quiz. There are videos to support all of this. We also have CE classes on the same content that is all designed to help you become the ultimate clinician you can be and help the most people that you can help with it. So to begin with, I'm just having a bit of an issue here with my screen, so I'm going to go back just a little bit in overall size, something like this. Yeah, we talk about key study tips that you'll want to use as a student or even as an adult student in practice. Then we break down our ranking system for how we actually evaluate the research and data that we're using. Oxford levels of evidence. Is the procedure easy to understand and follow? Does it follow current anatomical understanding? Is it usable as an outcome marker and potentially even a treatment? Because again, your assessment can be therapeutic. We talk about evidence-informed practice models. And I'm going to zoom in on this just a little bit. Evidence-informed practice models, clinical prediction rules, of course, and then how to connect with patients, working with pain and how to connect with people, and then psychology of injury. And this would be a standard chapter right here where you can see the objectives to start. So looking at the basics for how do you actually evaluate somebody, biopsychosocial models, chief concern interviews, and then outcome markers, pain assessment, progressing further into record keeping, of course, which is foundational for most of what we're doing. Determinants of health. This is a key underlying theme. What really determines if people are getting better or not? And looking at infection and hygiene, how to wash your hands, of course. And the basic process, of course, here is going through the HIPNRS protocol. So we can see that detailed and broken down: biopsychosocial, motivational interviews, history considerations for more significant injuries, so red flags of pathology, and then how do you do a chief concern history? How do you do family and social? How do you do a review of systems? All of that is covered here. Outcome markers to use, pain assessment with current pain science research behind it, and of course tissue-specific differentials and record-keeping options, and then charting and differential diagnosis, looking towards prognosis, review of systems, management plans, and a medical legal report. A lot of people ask about medical legal reports later on in practice. They don't realize the significance when they're a student, but you may find yourself doing these fairly often. So here's a great outline that you can use for this process. And then that gets us into the physical exam contents, where you can see we break it down from diagnostic equipment that you would actually use, skin evaluation, posture, gait, body mass, or body composition, I should say, and then palpation, range of motion, flexibility, all the other good stuff that we have to do there: goniometry and end feels, muscle and fitness testing, vascular exams, eye, ear, nose, and throat exams, cardiovascular exams, and various other ones as well that you might actually use in practice or at least refer to. And then, of course, looking at sample chart verbiage and imaging decision guidelines. So if we progress through here, we can see a lot of different content that gets us through gait cycle evaluation, body mass, all of that good stuff. And progressing in, keep on moving here. Hopefully you're finding information that you can use. Of course, again, every chapter ends with a quiz where you can look at the page to find the information that you want, or you can look at the learning objectives at the very start. The Neuroanatomy chapter takes you through a full neuro flow, neuro exam. So you're looking at pathways there, and then we progress through the rest of the nervous system so you can see what might be relevant for you clinically to assess somebody with. Joint mechanoreceptors, of course, dermatomes, and this is actually a pretty good page here that walks you through spinal levels and what happens for motor control, deep tendon reflexes, and sensation. And then progressing further into nerve patterns of loss, cerebellar function tests, Neurologic tests, all of that good stuff. Oh, Babinski's and all the variations around Babinski's, brachial stretch tests, ulnar and median nerve lesions, potentially sciatic nerve, cranial nerve exam in detail. And then every chapter now is laid out like this. So you can see, again, quiz to end each chapter. And we can also see learning objectives to start. But every chapter goes through anatomy, assessment, and then special tests that you might be using with this, and finishes off with imaging and questionnaires you might use. So you can see our anatomical drawings are all updated in nice color. So you can see the ligaments clearly and the bones. You can see the muscles and the kinesiology of the area. What a lot of students find really valuable is a quick DDX table at the start of each chapter that actually walks you through what could be the potential pathology. So is it a radiculopathy, history, signs and symptoms, and DDX, super quick. We also have video to support you of all of this content again, along with full regional exams for each body area that you can go ahead and look at. Then, of course, palpation videos are all there. Key structures you should be able to palpate. Range of motion, so you can think about when I move someone, what tissues are being activated, what's being stretched, what's being compressed. And progressing down further to passive range of motion, basics on muscle testing. These are neat, our differential diagnosis tables by orthopedic test at the very start of each chapter. Those are pretty useful. And then, of course, we break down in alphabetical order all of the orthopedic tests that you can go ahead and look at here. So, yeah. All the different tests. TMJ assessment is there. And then, of course, diagnostic imaging to follow it up. And a neck disability index questionnaire. T-spine and ribs, same process all the way through. So we start off with the bones, then we go into some ligaments and muscles and build up your knowledge base as you progress through, making relevant the information that you know, such as thoracic active range of motion. Again, what am I activating? What am I stretching? What am I compressing? Passive range of motion, same lists. And then breathing techniques, how you might use those, basic orthopedic tests that you might perform, and diagnostic imaging. And quiz to finish. Lumbar spine, same theme carries forward, right? And this carries through all the rest of the entire book, where you can see bones, you can see ligaments, you can see regional nerve innervation, and then, of course, some kinesiology on the actions, along with range of motion that you might do as part of your assessment or rehab protocols for someone. And then we progress through kinesiology again, and differential diagnosis and full exam flow, range of motion, muscle testing, toss in some cadaver pictures where we have them, and of course lumbar assessment in general, muscle testing, regional orthopedics, and then we break down all the orthopedic tests as we progress through. So you can see what the function of those tests might be, and then radiographic lines that you might use in practice on evaluation, and progressing through SI joints. You name it, you can see us progressing through, making that assessment therapeutic and giving you a greater sense of confidence in your overall exam of what's occurring with the patient and making better recommendations because of it. So I can click through some more pages, but you can basically see what we're doing here. I think maybe one other thing I should point out, where available, we include sensitivity, specificity, and likelihood ratios underneath each orthopedic test. I know other books kind of stuff it in the back of their text, but we found it useful to put it with each individual test so you could evaluate the clinical efficacy of that test right off the bat. But, you can see all the things we're looking at here. Carpal tunnel syndrome, of course, into the hip, regional differential diagnosis. It is got a ton of good information. Oh, the knee, fantastic stuff on the knee right there. So you can see all of that content as we progress through. Yeah, just going to cycle through into the ankle. Believe it or not, we're already on page 450 something, but there's a lot of good content, things you're actually going to really use in practice. We go into some basic healing times to look at specific injuries that take place, therapeutic order of treatment, progressing from least to most invasive, and then continuing on through orthotic use, muscle injury healing, ligament injury healing, bone and cartilage healing, fracture screens, fascial healing, pediatric exams, complete blood count, hormone review, and then, of course, getting optimal performance out of people, a little bit on nutrition and exercise, tracking nutrition over time, activity as medicine, and then a whole bunch of exercises that you can use, including case studies at the very end that will walk you through specific cases on each individual. And the case studies start off with a basic question like, what is hypertension? But then they get a little bit more in depth to say, what lifestyle changes are you going to make? And then they get into a mental emotional aspect, if you want it as well, that a patient may bring up. So here we can go ahead and see, and of course, table of contents to finish that off. And even the back of the book is usable as a, well, number one, to motivate you and yourself to find what success actually means. But the back of the book actually has rulers around the edges, and you can use it as a Snellen eye chart if you hold it 18 inches or about 45 centimeters away from your eyes. So you have a portable eye chart. And of course, all of this is supported with our online video content at Pro Central, along with multiple quizzes and CE classes. So if you've made it this far, I thank you very much for your time and hope that you enjoy this book and it helps you and your clients and patients that you might see in the future. Any feedback you have, we're all ears for it. And thank you very much. And I hope you enjoy your day.